what is the aim of personalized medicine for us to offer that to patients is clearly to make the therapy more efficient for a patient. So very, very short segue of the process. It's really to try to identify for every patient in his tumor what is the main molecular driver of his tumor. And we have to understand that patients differ between each other. So although they do have the same cancer type, for example, all have breast cancer or all have bowel cancer, they will have vastly different tumors. This is absolute new knowledge. And so what we are trying now as a medical community is to identify for each individual patient what is his type of disease and then give the drug that will work best.
It means to the patients, but also for the clinicians, I guess, that we have now left this area where we were trying to develop some more chemotherapy thing for all incoming patients, unselected, where I must admit we did not make progress this last 10 years, but we are moving more in using our knowledge about tumor, genetics of the tumor, proteins of the tumor, particularity of every tumor in every patient, in order to drive the specific good treatment and efficient treatment for these patients. So it's how to exploit the knowledge we have in genetics in order to find some targeted treatments for these patients.
The process of getting to a personalized medicine for a patient is very difficult, and it involves many players, and I want to highlight a few aspects of that. So one part is you have to have the relevant science, and I don't think we can imagine how difficult that is. Sometimes we believe with the genomic revolution, it's very easy, you can measure mutations and all that. You're going to find what's wrong. It's very hard. You measure things, you have to understand them, you have to see how they are working together, you need to understand the biology behind it. So this takes years and years of research. So why is it frustratingly slow, the process in personalized medicine? This is the main reason. The main reason is the lack of mature scientific insights where we have something to offer.
The only way to move, to prove the concept, to find new drugs, is to have very good collaborative groups and to make the efforts together in order to try a treatment in 100 patients. We need sometimes 10 centers, 1 or 2 patients per center, you know what I mean? We really have to really strengthen and reinforce in the future all the collaborative way to work. Without any competitive way of thinking, we have to work together in order to make the science move and forget about some kind of competition we were used to have in the past. And I think now the only way to move is to have really good networks of institutions in order to make new treatments come for the patients.
So the major advantages of personalized medicine are, of course, we will be able to give for a given patient a much higher care, a much higher level of therapeutic efficacy than we can reach now. Now we treat everybody in the same way, whereas we know it is different groups of patients. So that is the biggest advantage towards the patient, is the level of outcome that will be received by a drug can be tenfold what it is now. But to get there for that given patient, there is a lot of science going on behind the scenes, but there will also be probably another way of being monitored, of maybe having repeat samples taken, of having to do molecular diagnosis. Otherwise we cannot personalize the treatment. So there is two aspects to that that we will have to be working on in the next few years to implement that into clinical practice.
I don't think there is any field of oncology which is not concerned by this development. In the development of cancer, we now know it's a multi-step process. So if we can describe the steps, there will be ways to target these steps in every tumor, I guess. The question is just for the moment where the research does invest more priority and in money also, and this will probably make the order of discovery. But it won't change the fact that personalized medicine will probably concern every kind of tumors in the future.